when people can get them. The provincial government is responsible to create public health campaigns informing people how to get vaccinated, but this government muffled the voice of the Chief Medical Officer, diminished the ability and authority of public health officials. This disproportionately affects rural Albertans who have less choices of care nearby. Rural Albertans who want to get vaccinated need options, not American-style health care. So what will the minister do to make sure they have real access and not just more bills?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and thank you for the question. We are continuing to make sure that we promote vaccination right across the province. In fact, Mr. Speaker, we increased the number and the amount that we were spending on social media, as well as making sure that products were put into 14 different languages. We extended clinics, we extended hours for clinics in regards to the measles, and I'm happy to say that we've seen a steady decline in measles, particularly in the north and the south where it was most prevalent.
Given that's not the case in the Bow Valley, Mr. Speaker, where people at the door are telling me they can't get a COVID vaccine because they can't afford one, 811 is too busy and they can't get an appointment. Given that emergency rooms across rural Alberta are often closed at night, leaving Albertans to drive from hospital to hospital hoping to find one open, and today 25 communities have reduced service due to lack of staff like doctors, ER nurses, etc. Because of this government's continual attack on those contracts, given plans for American-style health care is going to hurt rural communities even more. What will the minister do for rural health care?
The Honourable Minister of Health.
Thank you, Mr. Speaker. We, in fact, have a rural health strategy, and we are targeting rural communities to make sure that they have the resources they need. It's why, Mr. Speaker, as I've said numerous times, that we have seen the highest growth in physician movement to Alberta in the last year alone, Mr. Speaker. When the members opposite were in government, there was roughly 5,200 family physicians. We now have over 6,200 family physicians, Mr. Speaker. We have more nurse practitioners, more paramedics, more staff to deal with rural issues.
Banff-Kananaskis.
Given those new staff are not in rural Alberta, Mr. Speaker, because I still have constituents who can't find a doctor. Given that the businesses like the Sutina Pharmacy are struggling to retain trained pharmacists whose visa extension hasn't been approved, I get continual emails from nurses who are also struggling to stay in the Bow Valley due to the cost of housing and the affordability crisis, and two-tiered American-style health care will make recruitment in rural communities even harder for our valued public health care system. Why is the government doubling down on failed American-style health care in rural communities?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And in fact, the members opposite continue to be incorrect, because we are in fact looking to well-developed countries that have universal health care that also provide a strong private health care system, Mr. Speaker, which in fact has increased access. Mr. Speaker, we are looking to make sure that rural communities have the resources they need. In fact, Mr. Speaker, when I was first became the minister in 2023, we only had a handful of people taking new patients. We have over 602 doctors taking new patients now.